Those exciting first 3 months when a tiny life begins to grow inside you. But along with the excitement comes a lot of questions. What should you eat? What should you avoid? How can you ensure a healthy pregnancy? Don't worry, in this video, we'll break down the most important do's and don'ts during the first trimester, so you can take care of yourself and your little one with confidence. Whether you're a first-time mom or just looking for a refresher, we've got you covered, so let's get started and make this journey a happy and healthy one. Don'ts during the first trimester of pregnancy. 1. Do not eat for 2. There is a notion that a pregnant woman needs to eat for 2, as a baby is growing inside her womb. However, this is not true as no extra calories are required during the first trimester. The need to add calories arises during the second and third trimesters. 2. Avoid traveling until necessary as it can worsen the symptoms of morning sickness. 3. Do not get vaccinated for tuberculosis, BCG vaccine, MMR vaccine for measles, mumps and rubella, polio, typhoid and yellow fever during pregnancy as they increase the risk of infections and birth defects. 4. Do not indulge in high-intensity exercises such as weight training, heavy lifting and sit-ups, as they can induce premature labor and bleeding. 5. Do not consume alcohol as it can result in neural tube defects in the baby. 6. Stay away from lead-based products such as paint or dust, insecticides, pesticides and repellents as their exposure can result in miscarriage, premature delivery and several birth defects. 7. Avoid using chemicals such as ammonia and chlorine as they can induce nausea. Other household chemicals such as paint thinners, cleaners and air fresheners can be toxic for the pregnant woman. 8. Avoid or limit caffeine consumption as it can affect the growth of the fetus negatively. 9. Do not get exposed to radiation such as X-rays until extremely necessary. 10. Do not consume raw or undercooked meat, liver and seafood as it can cause various infections such as listeria and toxoplasmosis, which can result in miscarriage and other pregnancy-related complications. Also, avoid fish with high mercury content such as king mackerel, tuna, shark, sea bass, and tilefish. 11. Avoid consuming unpasteurized milk or milk products as they may contain infectious bacteria such as Campylobacter, Brucella and Listeria. These bacteria increase the risk of miscarriage, preterm delivery and death of the fetus. 12. Do not stop consuming any medication for chronic conditions before consulting the doctor. Similarly, do not take any over-the-counter available medicine or any herbal supplements without consulting the doctor. So till now, we have learned about the things we shouldn't do during pregnancy. Now, let's learn about the things we should do. Do's during the first trimester of pregnancy. 1. Consume a diet filled with ample amounts of protein, carbohydrates, fats, vitamins, minerals and other nutrients to ensure the proper growth and development of the baby. 2. Add ginger tea to your diet as it helps combat nausea. 3. Keep snacks such as a slice of fruits, nuts and seeds handy to relieve the cravings. 4. Eat soft textured meals such as oatmeal or whole wheat pasta during constipation or indigestion. 5. Consume prenatal supplements of folic acid, vitamin D and iron to reduce the risk of occurrence of birth defects such as spina bifida, defect in the spinal cord, and anencephaly, incompletely formed brain, in the baby. 6. Brush regularly along with flossing to maintain oral health as pregnant women are susceptible to pregnancy gingivitis, inflammation of the gums. 7. Practice moderate intensity aerobic activity such as brisk walking, swimming, yoga or Pilates for at least 150 minutes a week. 8. Take frequent naps in the day to deal with the exhaustion and hormonal changes in the body. That's it for today's video on the do's and don'ts during the first trimester of pregnancy. We hope this information helps you or someone you know on